Good day, class. Our lesson today is all about medical legal aspects of death. So our discussion is all about kinds of death, signs of death, cessation of heart actions, methods of detecting the cessation of heart action, and circulation, examination of peripheral circulation, cessation of respiration, and cooling of the body. So kinds of death, there are three: somatic death, molecular death, and apparent death. So somatic death, it is also called as clinical death, and molecular death, it is also called as cellular death. Apparent death, it is also called state of suspended animation. So in somatic death or clinical death, in this discussion, it states that the body in which there is complete, persistent, and continuous cessation or stopping of the vital functions of the brain, heart, and lungs, which maintain life and health, it is called somatic death. It occurs the moment a physician or the members of the family declare a person has expired and some of the early signs of death are present. It is hardly possible to determine the exact time of death. Immediately after death, the face and lips become pale, the muscles become placid, the sphincters are relaxed, the lower jaw tends to drop, the eyelids remain open, pupils dilate, and the skin loses its portions of elasticity. The body fluid tends to gravitate the most dependent portions of the body, and the body heat gradually assumes the temperatures of the surroundings. Molecular or cellular death. In this discussion, it states that after cessation of the vital function of the body, there is still animal life among individual cells. This is evidenced by the presence of excitability of muscle, ciliary movements, and other functions of the individual cells. About 3 to 6 hours later, there is death of individual cells. This is known as molecular or cellular death. Its exact occurrence cannot be definitely ascertained because its time of appearance is influenced by several factors: previous states of health, infection, climate conditions, cellular nutrition influence its occurrence. So there are the several factors that eliminate the determination of the time of appearance of this molecular or cellular death. So apparent death or state of suspended animation. In this discussion, it states that there is a condition. It is not really death, but merely a transient loss of consciousness or temporary cessation of the vital functions of the body. On account of diseases, external stimulus, or other forms of influence, it may arise especially in hysteria, uremia, catalepsy, and electric shock. It may be induced voluntarily, as have been cited by foreign authors, in the name of Colonel Townshend, who could be able to pass into a state of pulselessness for half an hour. A voluntary suspension is shown in stillbirth. A newly born child may remain at a state of suspended animation and may die unless prompt action is taken. A person who has been rescued from drowning may appear dead, but life is maintained after continuous resuscitation. It is important to determine the condition of suspended animation. Why? To prevent premature burial. There are records of cases wherein a person was pronounced dead, placed in a coffin, and later angrily rise from it and walk unaided. It was news in the Daily Mail, England, 1948. The relative has sent death notice and placed wreaths near his coffin. So signs of death. There are three. Number 1 is the cessation of heart action and circulation. Number 2 is cessation of respiration. Number 3 is cooling of the body, also known as algor mortis. Cessation of the heart action and circulation. In this discussion, class, it states that there must be an entire and continuous cessation of the heart action and flow of the blood in the whole vascular system. A temporary suspension of the heart action is still compatible with life. The length of time the heart may cease to function and life is still maintained depends upon the length of time it is readily re-established upon the oxygenation of blood at the time of the suspension. As a general rule, if there is no heart action for a period of 5 minutes, so death is regarded as certain. Respiration ceases or stops frequently before the stoppage of the heart contraction and circulation. Usually, the auricle of the heart contracts after somatic death for a longer period than ventricle, and the auricle is the last to stop. Hence, it is called ultimen marinens. In judicial hanging, the heart continues to beat for 20 minutes or half an hour after the individual has been executed, although its beating is irregular and feeble. In decapitation of criminals, heart beating is present for an hour decapitation has been taken place. So methods of detecting the cessation of heart action and circulation. First is the examination of the heart. Second is the examination of the peripheral circulation. So in this topic, examination of the heart, there are 4 examination. Palpation of the pulse, auscultation for the heart sound at the precordial area, fluoroscopic examination by the use of electrocardiograph. When you say palpation of the pulse, it is the pulsation of the peripheral blood vessels may be made at the region of the wrist or at the neck. The pulsation of the vessel is synchronous with the heartbeat. Occasionally, the pulsation is very imperceptible and irregular that the extra minor experience much difficulty. Auscultation for the heart sound at the precordial area. So, the rhythmic construction and relaxation of the heart is audible. So, you can hear it through the stethoscope. Heart sound can be audible during life even without the aid of a stethoscope by placing the ear at the precordial area. Errors in the method of determining heart action. There are letter A is the heart itself may, like other muscles, be in a state of apparent and not a real death. So, and letter B, the heart sound may not always be appreciable to hear with the aid of the stethoscope. So, difficulties in auscultation may be encountered in a stout person, fatty generation of the heart, pericardial effusion. So, fluoroscopic examination. In this examination, the chest will reveal the shadow of the heart in its rhythmic construction and relaxation. The shadow may be enlarged and excursion made less visible due to pericardial effusion. When you say pericardial effusion, it is the buildup of extra fluid in the space around the heart. If too much fluid builds up, it can put pressure on the heart. This prevents it from pumping normally. So this illustration shows the precordial effusion. As you can see, normal heart and precardium. In the drawing and the illustration shows that the fluid is in a regular manner, and the other side the fluid overflows. So the pumping of the heart will become irregular. By the use of electrocardiograph, in this discussion, it states that the heartbeat is accompanied by the passage of electrical charge through the impulse conducting system of the heart, which may be recorded in an electrocardiograph machine. The electrocardiograph will record the heartbeat even if it's too weak to be heard by auscultation. So remember that the auscultation, it is the method to determine the heart action. Examination of peripheral circulation. So in this examination, it involves 8 examinations. So number 1 is the Magnus Test. Second is the opening of small artery. Number 3 is Icard test. Number 4 is pressure of the fingernails. Number 5 is Diaphanous test. Number 6 application of heat on the skin. Number 7 palpation of the radial pulse. Number 8 dropping of melted wax. So when you say Magnus test, it is a ligature. It is applied around the base of a finger. So uh, you apply tightening by a use of uh, thread or anything that which tighten the finger with moderate tightness. In a living person, there appears a bloodless zone at the site of the application of the ligature and a livid area distal to the ligature. If such ligature is applied to the finger of the dead man, there is no such change in color. So you apply it in a dead man, so there is no change in the color. Remember it, class. So the color of the area where the ligature is applied will be the same as the one distal to it. There may be no appreciable change of color if a living person is markedly anemic. So pag anemic yung tao, there is no change of color. So opening of small artery. In the living, the blood escapes in a jerk and at a distance. In a dead man, the blood vessel is white and there is no jerking. If the escapes of blood may only ooze towards the nearby skin. So pag the blood escapes, it will not jerk. So it will only flow nearby the skin. When bigger arteries are cut, blood may flow without the pressure continuously. So in this Icard's test, in this test, it consists of the injection of a solution. So it involves a solution. What is the solution? It is the fluorescent subcutaneously. If the circulation is still present, the dye will spread all over the body and the whole skin will have greenish yellow discoloration due to the fluorescence. So in a dead man, the solution will just remain at the site if the injection. This test should be applied only with the use of the daylight, as the color is difficult to be appreciated with the use of artificial light. Pressure on the fingernails. If pressure is applied on the fingernails intermittently, there will be a zone of paleness at the site of the application of pressure, which becomes livid on release. There will be no such change of color if the test is applied to a dead person. So Diaphanous test. In this test, also the fingers are spread wide. The finger webs are viewed through a strong light. In the living, the finger webs appears red but yellow in the dead. The finger webs may appear yellow in a strong light even if the living in cases of anemia or carbon monoxide of poisoning. So remember class, pag anemic or yung tao may carbon monoxide poisoning, the finger will appear also as yellow. Application of heat on the skin. If heated material is applied on the skin of a dead man, it will not produce true blister. There is no sign of congestion or other vital reaction, but if applied to a living person, blister formation, congestion, and other vital reaction of the injured area will be observed. Palpation of radial pulse. So when you say palpation, it is the palpation of the artery. With the fingers, one will feel the rhythmic pulsation of the vessel due to the flow of blood, and no such palpation will be observed in a dead man. And last is the dropping of melted wax. So in melted wax, sealing wax is dropped on the breast of a person. If the person is dead, there will be no inflammatory edema at the neighborhood of the dropped melted wax. Second is cessation of respiration. Like a heart action, cessation or respiration, in order to be considered as a sign of death, must be continuous and persistent. A person can hold his breath for a period not longer than 3 to 1/2 minutes. In case of electrical shock, respiration may cease or stop for some time but may be restored by a continuous artificial respiration. So it may be restored. In the following condition, there may be suspension of respiration without death ensuing. A. In a purely voluntary act, as in divers, swimmers, etc., but it cannot be longer than 2 minutes. Letter B, in some peculiar condition of respiration like cynic, Stokes respiration, but the apneic interval cannot be longer than 15 to 20 seconds. So, cessation of respiration, letter C, is in case of apparent drowning. D, newly born infants may not be breathed for a time after birth and may commence only after stimulation or spontaneously after. So, methods of detecting cessation of respiration. So, A, expose the chest and abdomen and observe the movement during inspiration and expiration. Letter B, examine the person with the aid of stethoscope, which is placed at the base of the anterior aspect of the neck, and hear sound of the current of the air passing through the trachea during each phase of respiration. Letter C is examination with a mirror. In this examination, you use a cold looking glass and it is placed in front of the mouth and nostrils. If there is a dimming of the mirror after a time, there is still respiration. The dimming of the cold mirror is due to the condensation of the warm moist air exhaled from the lungs if respiration is still going on. However, it must not be forgotten that the dimming of the mirror may due to the expulsion of the air from the lungs due to the construction of diaphragm in rigor mortis. Ordinarily, there is no dimming of the mirror when the subject is dead. D. Examination with a feather or cotton fibers. In this examination, you place a fine feather or a strip of cotton in front of the lips and nostrils. There is a movement of the feather or cotton not due to the external air. Respiration is present. The feather or cotton fibers will be blown away during the expiration and towards the nose and mouth during inspiration. This is not a reliable test because in a slightest movement of outside air or nervousness of the observer will move the feather or cotton fibers. So, letter examination with a glass of water. If you place a glass of half full of water at the region of the chest, if the surface of the water is smooth and stable, there is no respiration taking place. But if it waves or the water moves in your observation, then the respiration is taking place. This is not a good test because of the difficulty of preventing movement of the place wherein the body lies. Winslow test. In this test, there is no movement of the image formed by reflecting artificial or sunlight on the water or mercury contained in a saucer and placed on the chest or abdomen if respiration is not taking place. The reflection is utilized to magnify the movement of the surface of the mercury or water. So, 3. Cooling of the body. In this discussion class, it said that after death, the metabolic process inside the body ceases, means it stops. No more the heat is produced, but the body loses slowly its temperature by evaporation or by conduction to the surrounding atmosphere. The progressive fall of the body temperature is one of the most prominent signs of death. So the rate of cooling of the body is not uniform. It is rapid during the first 2 hours after death, and as temperature of the body gradually approaches the temperature of the surroundings, that rate becomes slower. It is difficult to tell exactly the length of time of the body because it assumes the temperature of the surrounding. Several factors influence the rate of fall of the body temperature. So class, thank you for watching the video, and if you like this video, please give it a thumbs up and please subscribe to my channel for more videos. If you have any suggestion or topic you'd like me to discuss, please make a comment.